Understanding labor terminology is important to avoid confusion and anxiety during delivery. Uterine muscles are just like any other muscle in the body. They tighten and contract. During labor, contractions usually start at the upper rounded portion of the uterus. This is called the fundus. Contractions create changes in the cervix, which is the neck-like lower part of the uterus that dilates and thins during labor to allow passage for the baby. Amniotic fluid is the water that surrounds the baby and protects the baby. The mucus plug adds another layer of protection which forms in the cervical canal early in the pregnancy. It prevents bacteria or infection from entering your uterus and reaching your baby. As your cervix prepares for labor, you'll lose your mucus plug. This is a common symptom in late pregnancy. The placenta is a circular flat organ in the uterus that serves as the exchange station for the nutrients and oxygen for your baby. The umbilical cord is the structure that connects the vessels to the baby in the placenta. Labor hormones are responsible for getting labor started. The first hormone is called prostaglandin. Prostaglandin causes a softening and thinning of the cervix. Oxytocin is a hormone which can help stimulate contractions. Pitocin is the man-made form of oxytocin used to induce labor. You may feel a sensation of lightness as the baby drops into your pelvis. Effacement is the gradual thinning, shortening, and drawing up of the cervix. So you may hear your doctor say 50% thinned out. This means the cervix is about halfway. The cervix starts out about as long and as thick as your forefinger. Dilation is the opening of the mouth of the cervix. This allows passage of the baby into the vagina. The dilation chart gives you a visual of 1 to 10 centimeters to help put it into perspective. Station is the relationship of the baby's head to the ischial spines in the pelvis. The ischial spines are prominent bony areas in the pelvis that we can use as a guide. When the baby's head is above those spines, you'll hear numbers like -2 or -3. If the head is below the spines, you'll hear numbers like +1 or +2. So if your doctor examines you and says you're 4 centimeters, 50%, and -2, you'll understand the relationship of the baby's location in the birth canal. Presentation refers to the part of the baby that is lying closest to the cervix, whether it's the head, shoulders, or buttocks. One last labor term you need to understand is intermittent uterine contractions that are unpredictable throughout pregnancy. These are also known as Braxton Hicks contractions. They're practice contractions to get your body ready for labor. The average time of labor is about 12 to 18 hours for the first baby, but everyone is different. It could be shorter or it could be longer. It's important to manage your expectations. Pre-labor is the changes that occur in the days before you give birth. Some may experience a nesting instinct or a big burst of energy. This is your body's way of getting you ready for labor. Remember to rest and make last-minute arrangements during this time. Have your bag packed and ready to go. The difference in labor contractions and Braxton Hicks contractions are labor contractions are regular and they increase in strength. The pain does not stop with walking and the cervix dilates. Braxton Hicks contractions are irregular. Intensity usually stays the same, the intervals do not get shorter, the pain is usually relieved with walking, and the cervix does not dilate. When timing contractions, you need to know frequency, which is how close they are, and duration, which is how long the contraction lasts. To time frequency, note the beginning of one contraction to the beginning of another. To time duration, note how long a contraction lasts from the time it starts to the time it ends. This is one of the key tasks performed by your support person. One of the questions you should cover with your OB is when you should go to the hospital. Every labor is different. Listen to your body and your instincts. Go to the hospital when your water breaks or is leaking, regardless of whether or not you're having contractions. Go to the hospital if your contractions are 5 minutes apart or less for at least an hour or more, or if you feel like you need to go. There are 3 stages of labor. The first stage of labor also has 3 phases, and those phases are called early, active, and transition. Several things can affect how long it takes to go from one stage to the next. The position of the baby, the size of the baby, the presentation of the baby, the size and shape of your pelvis, the effectiveness of your contractions, and whether or not you've taken certain medications. The first phase is usually the longest, with an average of about 6 to 12 hours for firstborn babies. Keep in mind, this can vary with a shorter or longer duration. As contractions start and progressively get stronger and closer together, you may start seeing a little bit of vaginal discharge or your water may break. Rest as much as possible. A little light walking may help. Your support person should be very encouraging and helpful. You'll want to start your comfort measures when contractions are starting to get stronger. In the active phase of labor, things will start to become a little more intense. This phase usually lasts about 4 to 6 hours and the cervix dilates to 6 to 8 centimeters. You probably won't feel very social or talkative, and you may need a little more support. You'll begin to feel more pressure in the pelvic area, and your contractions will get stronger. Some patients experience nausea and vomiting. Use your comfort measures like position changes, breathing, massage, or distraction. The support person should be giving you all of their attention during this phase. During the transition phase, the cervix is dilating from 8 to 10 centimeters. Your baby usually rotates into position for delivery. In this phase, you may feel out of control and less aware of your surroundings. You may start feeling the urge to bear down and push, and you may see a bloody discharge, shake uncontrollably, experience severe back pain, and have hot or cold flashes. Your support person needs to remain calm and encouraging and support your breathing. During the second stage of labor, you go from the cervix being completely dilated to the birth of your baby. You may experience a burning or stretching sensation as the baby moves down. A lot of people find that pushing is a relief. Some women experience the feeling of a bowel movement, and this is normal. Remember to rest and relax whenever you can. Continue your comfort measures. Rely on your support person. There are a variety of ways to push, and you may try several different ways before you find the one that's right for you. During the third stage of labor, the baby is born and the delivery of the placenta completes the labor process. This stage of labor takes anywhere from 5 minutes up to an hour. If you plan to keep your placenta, please make sure that your provider knows. Forest General does require consent to be signed, and the placenta has to be removed from the hospital within 2 hours. As your contractions start to slow, your uterus begins shrinking to around the level of the belly button. Some people do feel cold and shaky, and some may still experience nausea. Your support person can still provide your comfort needs. Use a warm blanket for you and your baby to help if you're feeling cold and shaky. You will have the baby skin to skin, so the blanket will provide comfort for you both. After the third stage of labor, you're going to begin the recovery care. During this time on labor and delivery, your nurse will monitor your vital signs and your bleeding. Your nurse will also massage the fundus to assess the location of your uterus and to help the uterus stay firm, which helps with bleeding. Be prepared for some emotional changes. The baby blues occur in about 9 out of 10 women. It's usually short-lived and it fades without any treatment, but you want to seek help from your provider if emotions get out of control. There are several ways to help combat the baby blues. First, try to get as much rest as possible. Allow others to do things for you and talk to your partner about how you're feeling. If you're single, find a support system. Postpartum depression and anxiety can develop. Be aware of the symptoms. a loss of identity, a feeling of a loss of control, constant crying, mood swings, constant doubt, feelings of hopelessness, nightmares, or even difficulty focusing. Postpartum depression can turn into postpartum psychosis, which is a medical emergency and needs attention as soon as possible. Symptoms of postpartum psychosis include a sense of confusion, inability to remember how to do things, and an inability to control your thoughts. You may experience hearing or seeing things that no one else does. You may feel like you're not in control of your body or your speech. You may even have thoughts of harming yourself or your baby. Remember, seek immediate help if you're having any of these symptoms. It's important to prioritize your health and the health of your baby. Don't hesitate to contact your healthcare provider if you have any questions or concerns. Your obstetrician gynecologist is committed to supporting you throughout your journey. To learn more about Forest General Hospital's Women and Children's Services, visit www.forestgeneral.org/women.